Welcome to On the Pulse, everyone. I'm over here with paediatrician Dr. Andrea Logan, and today we're talking all about the flu shot, the progression it has made, and the questions that you may have at home. Welcome to the show, my friend.
Thanks for having me.
All right, the flu shot. When should we be sort of looking at having them done? Around about now, right?
Right, so the flu vaccine normally comes out in September, October, so I always tell my patients when you're picking out your Halloween costumes, think about the flu vaccine.
Oh, of course. All right, I do want to ask you a question because you are a paediatrician. What age would one be having their children with the flu shot? And do children have them done?
Yes, it's actually most important for the babies because they're at more risk for having worse complications of the flu and hospitalizations and bad things can happen to little bitty babies and elderly people if they get the flu. So babies are eligible for a flu shot after 6 months of age. So
6 months, everyone.
The baby, if your baby is younger than 6 months, that means mom, dad, grandma, and sisters and brothers better get their flu shot.
I remember when my friends all started having babies and they'd say, oh no, you can't come over, Troy, if you got the flu. We're like, well, I'm sure the kids got one already. Do you know what I mean? But they are highly susceptible to catching these type of, are they disease?
Yes, yeah, and little bitty babies are just, you know, their immune systems aren't fully developed and they're at risk of severe complications.
Okay, well, let's get down to the nitty gritty of it, will we? Every year they change out the vaccinations because the flu strain changes.
It changes a little bit every year. So that's why the flu vaccine is not a perfect vaccine. It's not going to be 100% effective. But it does, even though it's not perfect, it does decrease the morbidity and mortality associated with the flu. We have several thousand flu deaths annually in the U.S. So people who get their flu vaccine are less likely to have severe complications.
And that's something we wanted to talk about as well, that not everyone who gets a flu shot gets the flu, because that's not really true, is it?
You cannot, let me emphasize this, you cannot get the flu from the flu shot. It can't happen. It's a killed virus vaccine. You cannot get the flu from the flu shot. But I have a theory. I think I know why people think that, because
it's mental?
Well, it's because it takes 2 weeks for the flu shot to work. So if you get your flu shot today and someone coughs the flu on you tomorrow, you can develop the flu and you're going to say, well, I just got my flu shot and now I have the flu. Well, that's because you were exposed to the flu. And you know, we don't give the flu shot year round. We don't give it in July when you're healthy. We give it in October and November when everyone is sick.
So okay, well now you say that, can you have the flu shot? Because you get a summer cold.
Yeah, you can have the flu shot if you're experiencing cold symptoms. That's not a contraindication. If you're running high fevers, we may not give it to you, but if you just have a little sniffle, you can still get the vaccine.
All right, so where is the best place to be able to get your flu shot?
You know, drugstores give flu shots now. They have some limitations based on your age and if you have certain illnesses or things. So your primary care doctor for sure. For children, your primary care doctor, me, is going to be the one to do that. But adults and older teens can get it, you know, at the Walgreens or wherever. Okay.
It's October, I didn't get a flu shot. All of a sudden my co-workers at the office are all getting sick. Too late for me to get a flu shot?
You can certainly get your flu shot. If someone really close to you has exposed you to the flu, remember it takes a good 2 weeks for that flu shot to do anything, so I can't help you from the germs you were exposed to yesterday.
What about all the nasal sprays that you see on the market nowadays?
Well, so there is a nasal flu vaccine, and it's good for some people. So if you're terrified of needles and you need your flu vaccine, you can probably get a nasal flu. That one is a little different because it is a live virus, so some people are not able to get that vaccine. So very young people or asthmatics or people who have had wheezing recently can't have that vaccine. So ask your doctor.
Well, we appreciate yet again everything that you give us, all the information. We've had lots of viewers write in and say you're amazing. We appreciate you. If you want to find out more information about Dr. Andrea Logan, there it all is up on the screen. She will take care of everything that you need. She's just over there at Ocean Springs. Come over and give her a call. Take your little ones over. She'll take care of you. Appreciate you.
Thanks,
back after this short break.